Okay, so our group has the task of talking about our questions, synthesize methods to effectively work with patients who are angry, depressed, or considering suicide. I read the book Fortunate Son.
And then we all watched the movie Born on the 4th of July. And I am Nick.
I'm Bethany.
Kyle.
Jake.
Nick.
I'm Matt.
All right. So kind of how we wanted to start it too is, so has anyone seen or been a part of a patient experience that has really pertained to this question, as far as maybe suicidal depression or angriness?
Well, I guess now that we talked about it, we did have one patient in the clinic this summer who, so she was doing really well. She had the diagnosis of sciatica, so we were treating her for that. Everything was going really well, and one day she came in just like, I don't know, she just wasn't herself. She said things have gotten a lot worse. So then my CI kind of talked to her more, and it turned out that her husband actually passed away a year prior to that date. So she was obviously in a depressive state, and so we kind of just talked with her and empathized with her a little bit, and that really helped her in that regard.
For sure. So that would be, did you find any of your articles hinting at something like that?
Yeah, actually I found one article about coping mechanisms with people who have depressive symptoms, and then just one of the biggest things is establishing a therapeutic relationship with the patient, letting them seeing their side of the story, and then being open with embodied questions, just trying to get at where they are as a person and then help them holistically as a patient.
Sure.
It's kind of the overarching theme of a lot of my articles too, was that the biggest things was being supportive, being able to understand where they're coming from, and then kind of being a good listener.
Yeah, on top of that, just creating an atmosphere for the patient, warming, comfortable place.
That's safe.
Environment, yeah.
Mm-hmm. I know I personally was a part of patient interaction this summer where I went straight away from my CI because the hand therapist there, OT, approached me. We got pretty close over the summer, and he told me that he had a patient that had recently attempted suicide, and wanted me to sit in to kind of get a good experience with that. And I wasn't too close because obviously the patient might not like that. And how our OT was set up is it was kind of in the middle area of the clinic, so it wasn't too private, but it wasn't too public. So I didn't sit right in on it, but I kind of sat away and pretended like I was doing something else. And he said, "I'll introduce you, but don't obviously get too involved." So then with that, it was really interesting to see the interaction with the OT and the patient, because the patient recently just attempted suicide. So he had a lot of damage to his wrists, and the OT then had to find a way to motivate this patient that just tried this to then now strengthen everything that he just disrupted. So that was really interesting to see, and he told me that he had experience with suicidal patients, one similar to that, and the way he handled it was really good. He kept everything relaxed, never brought up anything of the suicidal attempt, and then he also really kept it patient-centered and talked a ton about the patient's life and made sure to direct everything towards positivity in his life, straying away from negative. If anything negative came up, he would kind of change the subject, bring it back around to be positive about it, ask him things he liked, things like that. And it was kind of interesting to see how much it worked, because from the beginning of the session to the end of the session, the patient was a little bit, you could just see his face was a little more lively, and he was more, I guess you could say, involved in the therapy session with him.
Yeah, you mentioned the therapist didn't really jump in and remind the patient necessarily every single time. It was kind of
right.
Retract back. I came across kind of a journal that was the dilemmas that families face in talking with returning U.S. military service members about seeking professional help for mental health issues, and kind of the same topics of it's not. They found that negative factors of it were constantly addressing, even though you want to address the issue in some cases, but they found that was a negative thing for people, and that a benefit or beneficial thing for patients to seek medical help if they had a mental health issue, was maybe bringing up the topic and waiting until, they wanted to talk about it. So.
Did any of you, in any of your articles, see any like negative stigmas about veterans or any population going to get mental health treatment or anything like that?
I think there is a stigma of
Yeah.
it.
That's it.
People who are returning home and stuff like that. I found another kind of interesting thing in there, that the overall U.S. population, only 1% of the U.S. population is in service right now, which is the lowest it's been since World War II. So as far as having the same idea of someone returning home to the normal population, there's kind of a barrier there. Totally understanding what it really means versus having 5%. Even there's more people out there to kind of relate to you. So
Yeah.
and then the idea of being strong and not having mental health issues.
In one of the articles, it talked about like what are the biggest barriers or risks that why people don't go seek mental health care. And one of the biggest things was that stigma that they thought people would have of them going to get mental health, when in reality, like there's a lot of things out there that are trying to change the stigma. Like mental health is obviously in the forefront in all Americans right now, and over the span of the whole world. It's a big thing that stigma has to kind of get decreased, and just having an awareness of the benefit that these places can have for individuals that are in a depressive state, that can bode well for them for outcomes in the future.
Yeah, I found, kind of going off that, one of the articles that I found was talking about suicide risk among veterans, both that fought in conflicts like the Vietnam era and back then, as well as like conflicts this century. And a big predictor of things like suicide risk was the young age.
Yeah.
And one of the best, I guess, predictors of decreasing that risk is like early detection. It sounds like super like simple and something like kind of obvious, that one of the best predictors would be early detection. But that kind of just reminds me of like the role that we play as, it's kind of a screen, if nothing else, to identify that maybe there's some psychological type thing going on here, whether it's a referral or whatever they're willing to do. But detection early on was a big predictor of decreasing that type of suicide risk.
That's it. Yeah, I found a study very similar to that, talking about young age. This is more specifically looking at like Afghanistan, Iraq war veterans that are younger, like between like 18 to 25 was like the biggest risk of suicide, like suicidal ideation. So yeah, it's definitely something that we need to screen, especially younger populations.
And then along with that, I found that a TBI or multiple TBIs increases the risk in the veteran population, which is just interesting. So being younger and then having multiple TBIs, it seems logical, but it's not something that I had thought of before.
Yeah.
I thought, I guess I'm kind of going back to the suicidal thing, but I had a very interesting article, and it related perfectly to our movie and our characters. And so it was looking at, it took a bunch of people that have attempted suicide in the past, and then it compared treatment involving the traditional route, which is therapy sessions, and then kind of cutting them cold turkey, and then they're going back out into the world. And then it compared it to their acronym. It was like NIPS or something like that. And what it involved then was, it was the traditional therapy session, but then followed up 2 years of sending personalized notes and letters back and forth between the patient and the therapist. So it was really cost effective. It's super easy, and it was still personal. And I thought it was very beneficial because it was a way to keep things kind of hands off and nothing too direct. Like you were saying, people don't want to go in to see a medical provider, so this provided them a way to still yet talk to someone who's qualified to deal with their issues and give them good insights, good helping points, things like that, but not have to tell anyone that they're doing it, not have to be seen walking anywhere, not have to do anything out of the ordinary. And it also worked perfect for veterans because, especially in the olden days, I guess not really olden days, but like Vietnam War and things like that before technology was big, where they'd have to send letters. I thought this would be a great idea for them, or even people nowadays that won't have access to Wi-Fi, things like that. They still have to send letters. It's a way to slowly implement them back into society because they can still do something they're used to, writing these letters to loved ones, but now to someone that is going to have their medical care. So they're sending letters back and forth. So it's something they're kind of used to, slowly implementing them back into society without having to just throw them into the water. Good luck, go into the office, face to face. So that way they can, and it's always easier to write out things and write out your ideas and how you're feeling, things like that, versus saying it. Sometimes it's hard to say it, especially if someone's there listening. But if you can write it out in your own private room and then send it, sometimes you can portray more details of what's going on in your head.
Did anyone find anything interesting about effectively working with patients who are angry? Since we haven't really talked about that yet.
I found one article that kind of compared a usual protocol that they use for angry patients, and then they compared it, or angry veterans especially, and compared it to using that therapy plus like a phone app, mobile application. What they found is that it wasn't any better. It wasn't significantly better using the mobile application as well, but all the veterans who did the mobile application as well felt that it was just so much easier to use that. Obviously, if you have older veterans who aren't good with technology, it probably wouldn't help, but most people are moving towards technology, so it's really convenient for them, and they don't have to always come in and see someone necessarily, and it'll help them reduce their anger. Then
What did that app do? Was it like mood tracking? I don't mean to put you on the spot.
I can't remember specifically what the application was all about. I'd have to read into it more, but
I had an article about anger and anger management, things like that too, with patients. But it was kind of more of a systematic review, and it looked at a bunch of articles. And I clicked in to look at the other articles, and none of them were really significant. So looking at the review was kind of nice because it pulled in all the points from each one. And kind of the main takeaway points from it was that teaching patients self-management techniques and self-awareness techniques of their emotions, how they're feeling, how they're acting, ended up benefiting them. It wasn't super significant initially, but over the long term, those that stuck with it and then self-reported that they were continuing with it improved a lot more than those who didn't. And it's something as simple as just being in their own head, doing it themselves. So they really didn't need to go to all these appointments, things like that. So for them, similar to other studies, it's cost effective because they can kind of take matters into their own hands, which can be empowering for a lot of people, especially people struggling with anger and things like that, knowing that they can change it themselves versus having to go out, reaching out.
And just like, I saw a lot of things in my articles, like not specifically talking about anger, but a lot of just like, their symptoms of depression or anger, regardless of what it was. Kind of the biggest thing was just the perception of unmet like healthcare needs. I know with the video that we watched, Born on the 4th of July, the VA scene was very disturbing. But obviously, like that could pose some anger to veterans or any person in the medical field when you don't think that you're receiving the best care. So, Beth, you didn't see the movie, but and obviously, just with the video, the main character Ron came back from the Vietnam War, and he was in the VA because he was paralyzed and getting treatment in there, and very mistreated, wasn't getting the attention that he needed. So just like how would you guys handle that, like with an angry patient like that? Like obviously you're going to try to get them, but like I don't know, I just kept thinking about that, like what could I do in that situation to help him calm down or help get him what he needs.
Yeah, I know over the summer I had one veteran who, Vietnam veteran, I don't think he dealt with like PTSD or anything like that.
Yeah.
He wasn't a combat veteran. But he did deal a lot with things like I don't know the whole details. I assume along lines of depression and a lot of anger surrounding the VA system, whether it was with treatment or if it was medications or whatever. And I found that the best strategy was to not always like full on agree and like trash talk the VA the whole time, but to at least validate his anger. Like, I get where you're coming from. That is frustrating. Like, and then either redirect or just be like, how can I help, or what can we do here through physical therapy?
Yeah.
Personally, I was at a VA this summer, the St. Cloud VA, and seeing the movie and then seeing where I was like, they've come a long way
Yeah,
since
yeah,
then.
yeah.
Obviously, they still. The St. Cloud VA is actually like one of the best VAs in the country
Okay.
rated. But obviously they still deal with veterans who are angry and are like, I'm not getting the best care I should be. But it's gotten way better than that, obviously what was in the movie.
Yeah.
Did you do any depression kind of screening?
No, I never. Since I guess they're pretty good about having comprehensive care. So if a veteran ever had any signs of depression or they screen them for suicide. A lot of times, usually us in physical therapy, we didn't have to deal with that because generally someone would catch it sooner before they come to
Okay.
physical therapy. So they are very good about them seeing doctors, mental health specialists, and everyone there is making sure like we're trying to catch people early before any of that happens.
Sure.
Kind of going off what Matt said, in our PCM modules, our vet that came in, he was acting, but it was his exact same story. And after everything was done, the one thing that he said, he pointed out someone specifically and was like, you were the only person that validated me, and that made a world of a difference. Like, that's what I look for, because I'm angry and frustrated, and so if no one validates me, I'm not going to respect you as a practitioner, basically. So validation and coming down to their level and understanding where they're coming from
I think
can be huge.
We kind of saw that in the movie too, where when he was in the VA, he got really angry, and rather than like seeing like we get where you're coming from, probably because they were part of the problem, the practitioners.
Yeah.
They just said like, "Are you going crazy?" Even though like he'd been laying upside down in the bed for hours,
Yeah.
and he'd been in the bed for like months. Like,
Yeah.
and they were just saying like, "Are you going crazy?" Rather than like validating
Right.
and get it like you're paralyzed, you just broke your leg. So
Even he like screamed, "I just want to be treated like a
Yeah.
human."
Yeah.
being," and then he wasn't being treated like a human.
yeah.
Right, rats running around the floor.
Exactly.
Yeah.
Although the one doctor that came to see him, he kind of did validate his anger because he's like we're trying our best, but we're getting cut in funding, and
Right.
the doctor
Yeah.
knew. He's
The
like,
doctor
I'm
wasn't
trying to treat all these patients, but I don't have time to kind of thing.
Yeah, that's tough. That is very interesting.
So, did you guys find anything in your articles about like specific interventions and how they relate to depression?
I found one that was really beneficial, and you're starting to see it more as a treatment and intervention for a lot of different disorders and problems, things like that, was dance therapy. And this dance therapy was interesting because it wasn't just show up, dance, see ya. It was, they showed up, they warmed up together, they danced, and it was small groups. It was groups about 7 or 8. They would dance, and then they would have a discussion at the end with the group on how the dance went and like how they felt they were doing, things like that. And then they would, after that, have 10, 15 minutes where they'd sit down individually with a therapist, and then they could talk about it again. And that was a randomized control trial between that and a traditional treatment, and that was significantly more beneficial for the patients in helping them with their depression, anxiety, things like that. So I feel like that is something really beneficial to not even just strictly doing dance, but doing something where you can then talk about it in a group setting and then also individually. That gets 3 components. And like a huge part of that, dance itself too, they kept hinting at, kind of, blowing their own horn, tooting their own horn. But how dance then, it incorporates cognitive, emotional, spiritual, physical activity. So it kind of involved everything because you can get out emotions, you can get everything out. And I thought that'd be a good thing for maybe anger to go into too. A good way to get out some anger, because some people like to do expressive dance.
Mhm.
things like that. So I thought that was pretty cool.
Well, Jake and I both had the same article. It's called Crawling Out of the Cocoon. Their experiences with a physical therapy exercise intervention. So going off activity, the study did a lot of aerobic exercise, whether it's biking, walking, just because that's shown to have a good effect with modulations in the brain to help with depression. But this looked more at like their experiences, and kind of the biggest takeaway, and Jake can kind of bounce off me here, but it's just like their ability to like kind of take control over themselves again, having this regimen and getting back into an exercise routine just kind of made them more capable of themselves, like feeling that they can be a part of something, do something. There's also some group aspects with the interventions, and a lot of people liked being a part of the group because it made them feel accountable to be at the interventions. Like it was like really eye-opening just with what role PTs could have with helping with mental health just with an exercise prescription.
And then kind of going off that too, they talk about major thing of depression and stuff like that, and what people feel. They talk about deadlock. They kind of stated it as that, and they kind of three components of it were stiffness, numbness, and encapsulation with depression. And exercise, they believe, kind of helped them kind of get rid of some of these things, the stiffness and the encapsulation, where they were able to go exercise with other people, able to do their own thing, be able to move. It's kind of going back to Rescuing Jeffrey too. You express what you do with your hands and your body and stuff like that. And a lot of times when you become depressed, you slow those expressions down. So I think with movement, it showed in the study that it allowed these people to kind of learn to that movement, it relates to your brain and how you feel.
Definitely.
Yeah, I'd found one about, and it sounds like common sense to us, but like making activity-based interventions, specifically is related to vets, and it's talking about how return to activity and return to function is a good predictor of, I guess, good psychological outcomes. In fact, one of the biggest predictors of suicide risk among, I think, it's Australian veterans was unemployment. And so if they don't have that function to hold a job, whatever that is, that automatically increases their risk of suicide. And so I just found an article about they kind of almost described it like hope-based interventions, going back to the movie, and you didn't see it, but at one point there's a doctor who's bedside, and he's like, there's minimal chance of you walking again, and then by the end of the interactions, he's like, you'll never walk again. Okay. And then later on in the movie, there's this whatever, rehab tech or whatever he was, helping the guy walk, and he wasn't walking, he was just dragging his feet around. But he thought he was walking, he thought he was progressing towards it. And even if it was a little unrealistic, and you probably don't want to go too far in the direction of saying there's a chance of somebody's walking, there probably isn't. That hope-based intervention of restoring that function is really big for patients versus just kind of a traditional do exercises or do maybe less functional activities.
For sure. I had another interesting article that looked at virtual reality for depressed patients, and what that involved was putting them in the virtual reality and then having them complete exercises and repeat the questionnaires that they were doing. Kind of like self-conscious, self-awareness questionnaires, having them repeat it, and they're in the virtual world, whatever, and in that world they're in this room with mirrors, so they can see themselves as a virtual character, but it's them and they're moving. And they had them do this as they were an adult, as they were a kid, and then as an adult talking to a kid. And they found that this was really increased. It's kind of interesting how they did it, but it really increased their self-awareness, their belief and things like that, and it lowered their self-criticism as well, because that was their main grabbing point for what patients they used, was if they were scored high on their self-criticalness throughout their life. So that was pretty interesting how we could then keep up with times, technology, to find a way to then use virtual reality for therapy.
Did anybody come across anything in gender differences maybe between depression at all?
Other than kind of in the introduction of stats, we already know that females are more apt to attempt and males are more apt to have less attempts and more like actual suicide completions. But other than that, nothing specific.
I came across something kind of interesting. The study was gender differences in depression among veterans with spinal cord injuries. And like you said, that there's a higher incidence of depression in women. But we talked about earlier too, the highest incidence usually occurs within that first year, saying, that's the time when you should be evaluating the most. It's twofold almost compared to the general population, and then it kind of levels back out, but still at a higher incidence. But they said for the biggest outcomes or the assessments that you should be doing with patients who are female, and initially is life satisfaction questionnaires or outcomes assessments, something like that, that evaluates that. That's the biggest predictor for depression among females following spinal cord injury. And then for males, it was also satisfaction, but also there's a big piece of just bodily pain or pain with it also, where pain really wasn't a factor with depression for women as much. So assessing for males, pain and satisfaction of life, and the bigger thing for just satisfaction for female, life satisfaction.
Do you have any specific interventions that you?
I guess just going back to that, I guess the mobile application I figured out was so that it's a mobile app where you can talk to your physician through it. You wear a trackable heart rate monitor, and it kind of just gives you some anger reducing activities, I guess. So you can keep track of your anger level and through your heart rate as well, wearing a trackable heart rate.
Was there anything specific you guys did at the VA for situations like this? Like if you would have known beforehand the patient?
I guess, yeah, when you're doing your chart review, check to see if they have either, depression or anger problems, and obviously make sure not to use your words carefully, not trigger anything. But again, I guess I generally didn't see any patients that were where I felt like I needed to be on high alert.
Sure.
So
I did have one of the articles I found was kind of a new standards of care with suicidal patients or suicidal ideation patients. A big thing was establishing a care plan with someone, kind of like having a family member or something, kind of watching over them, especially if they're living by themselves. But a big thing there was kind of getting that set up within 48 hours of them kind of expressing suicidal ideation. And then also just kind of having a safety plan and trying to remove lethal means of harm, whether that be guns or anything like that. Just trying to come up with a plan and kind of have them rethink about what they were planning to do, or so it hopefully doesn't happen in the future. So
one of mine was kind of about suicidal ideation in children, and that was one of the things that they had found was that by removing any life-harming objects, putting locks on safes and whatnot, did make a difference. And it was really also talked a lot about implementing school-based interventions that kind of cast a really wide net so that it's not a stigma that everyone in the school is going through it, and then just a lot of hotline stuff. So
one of my, sorry, finish.
Yeah, there was a 24-hour hotline, and then also they started setting up social media stuff, so via Facebook. So.
I just one of my articles was looking at suicide and death ideation with people with mental illness, veterans versus non-veterans, and so it's kind of putting a lot of factors together. But the veterans had 3 times higher death ideation and and 2 times higher suicide ideation than non-veterans with mental illness. And just relating that kind of to the movie, I was like, veterans come back and they, when they're serving, they kind of feel like they have a purpose. They're either like fighting this war, they come back to civilian life, and they're kind of like, if they're unemployed coming out of the service and stuff, especially, they're like, why am I here? What am I doing? Like, I'd be better off dead. And I kind of saw that with, not to that extreme, but I kind of saw that with some veterans where they were kind of like, I'm kind of being a burden right now to everyone, and not necessarily that they wanted to commit suicide, but they're like, I don't want to be a burden to people around me. It was a big thing that they didn't want to do.
Sure.
And that was kind of, I mean, there's a lot of factors in the book, Fortunate Son. It's just an autobiography of his life, but especially for vets coming back from the Vietnam War, people were treated like absolute crap after the Vietnam War because of all the media going on at the time. And so that's where he had served and had his legs blown off by a landmine. And he also had a factor of his dad was a successful Marine, and like Russians studied his strategies of combat because he's like this world famous Marine. And so he also had like the shame of never living up to his dad, along with all the factors of and like life changes coming home after that, and
Just like public negativity, just constant.
yeah,
For sure.
it's like unimaginable.
Mm-hmm.
Yeah, one of the big problems with the Vietnam War and vets was like, they're the kids of like, a lot of times they were the kids of like the World War II vets, and they came back and everyone was like, you guys are amazing, you guys are heroes. These vets are like, they see their parents who are World War II vets, and like, okay, I'm gonna go in, and they're really motivated, go to the Vietnam War, come back, and everyone's like, you guys are garbage, we didn't want this war, this isn't good. And they're like, why are we getting treated like crap when our parents who served in World War II were
Right.
heroes?
Yeah.
Yeah, continuing on that timeline, I kind of addressed it already, but then the wars that we're at now, you know, the sexually traumatic issues and stuff like that, and war with increasing female population and serving right now, also being aware of that, especially with women having higher incidences falling in service.
Yeah.
For sure.
All right. Does anyone have any final talking points you want to hit on? All good?
This has been good.
Yeah.
Awesome.
Okay.